Hi, I'm Dr. Stansberry. Welcome to Go Healthcare. My purpose is to find out what is causing your problem so we can provide you with the appropriate treatment recommendations. So what needs to be done to get started? Once you fill out some history forms, then we'll sit down together and discuss your issue. We'll take x-rays, then we'll schedule a return visit to cover the findings and go over our treatment recommendations. Also, we'll review any imaging that you have as well. So what is normal and what is abnormal? To do that, let's take a look at the Kellgren-Lawrence scale. Grade 1 of the Kellgren-Lawrence scale says little to no joint space narrowing with possible small spur formation. Grade 2, definite mild joint space narrowing and definite small to moderate spur formation. Grade 3, multiple moderate spur formation and moderate joint space narrowing and possible bone deformity. Grade 4, large spur formation and severe joint space loss or bone on bone and definite bone deformity. So we need to establish what phase you are in. Then, what is the most appropriate treatment? With healthier joints, therapies may provide the relief needed. However, most have varying degrees of degenerative arthritis, and that is why they're here. Some patients will move right into cortisone injections. Unfortunately, more arthritis develops, pitting and damaging the cartilage, and you still have arthritis. Over time, range of motion becomes more restricted. It does not protect the damage to the joint. It causes a bit of bone loss as well. In other words, osteoporosis. In extreme cases, necrosis or bone tissue dies. The Rooster shot or hyaluronic acid injection is a synthetic lubricant. It lubricates the synovial fluid and cushions the joint. It does not stop arthritis. It can be done every 6 to 12 months. Every time you get the Rooster shot, it lasts less time. So if it lasts 6 months the first time, it may only last 4 months the next time, and then 2 months the next time. Since it does not stop arthritis, more arthritis will develop over time. Then there's PRP. PRP became a household name by Hines Ward and Troy Polamalu during the time of the 2011 Super Bowl. Neither could play, and a week later, they both played in the Super Bowl. People asked, how did you heal so quickly? The answer is PRP. PRP stands for platelet-rich plasma. Basically, we draw blood from the arm, we centrifuge it or spin the blood. This separates the platelets from the blood. It's the platelets that we need because that's what we inject into the joint. It's the platelets that heal. So for example, if you cut your hand, platelets heal the cut. In open heart surgery, they cut open the chest, and when they close everything back up, they squirt a little PRP into the ribs, and that helps to heal the ribs faster. So it speeds up the healing process. It causes new blood cell formation. It causes degeneration to stop. It does not grow new tissue, however, but it does help the tissue that is there to heal. PRP is a big proponent in helping joints and arthritis to heal. What if the joint is beyond what PRP can do? Then it's stem cells. Stem cells have been around for decades. Stem cells are what we are made of. The age of the stem cells are important to the viability of the cells. As a matter of fact, out of all the cells in the body, in infants, 1 in 10,000 of every cell is a stem cell. At age 16, 1 in 40,000 is a stem cell. At age 50, 1 in 400,000. Age 60, 1 in 1 million. Age 80, only 1 in 2 million is a stem cell. So when we fall down, as a 2-year-old, we jump up a lot quicker than as an 80-year-old. That's due to the plasticity of the tissue, which is directly related to their stem cells. Stem cells grow new tissue, not part of the time, but all of the time. That's their job. There are a couple different places stem cells come from. Bone marrow of the hip, also fat tissue, such as in liposuction. Like I like to joke around with my patients, if a patient is old and decrepit, then their stem cells are old and decrepit too. So your body is not the best place to get the stem cells from if we're trying to regenerate a joint. These types of stem cells lack cytokines and growth factors, which are very necessary to help in regenerating a joint. Pro athletes used to go to places like Germany to get this done. Germany does not have an FDA. In Germany, they can mix in cytokines and growth factors, and that's done at a cost of $50,000 an injection. Technology has improved, and now we can get stem cells that have cytokines and growth factors naturally in them. They come from a donor. It is technically called a tissue allograft because it comes from another person. They come from the umbilical cord, blood, and amniotic tissue. So here's the basic process. A woman donates her placenta and umbilical cord tissue. She is screened heavily, just like an organ donor would be. At birth, instead of the placenta and the cord being discarded, it is collected and processed and immediately frozen at approximately negative 200 degrees Celsius. When it is thawed out, the stem cells are very viable. It's like having a 2-year-old run around inside your knee as opposed to a 70-year-old running around inside your knee. So that is what we do to help prevent someone from having a knee replacement surgery or a hip replacement or a shoulder replacement. Furthermore, folks are often unaware. After a joint replacement, half of the patients still have pain at an average of 3 to 5 on a pain scale of 0 to 10. Not to mention, 6 to 10% get an infection lasting weeks to months. 1 in 200 people die of blood clots after joint replacement within 30 days. There are weeks, if not 3 to 6 months, of PT that is needed. A lot of downtime. There is numbness always. Reduced range of motion, usually. Many say it just doesn't feel right because it's not right. It's actually a titanium joint. Stem cell therapy or tissue allograft is more popular now than ever because people want to keep their joints. They don't want the risk of infection. They don't have a long recovery time. And essentially, once it's injected, you just take it easy for 72 hours. There really is no downtime. Historically, 65% of patients post-stem cell therapy have the pain relief they originally sought by the 30th day. As the regeneration process continues into the 2nd, 3rd, 4th, 5th, 6th month, 95% of people are able to do all the tasks that they want to do without the pain and limitation. As a matter of fact, stem cells will continue to heal for up to a year. Listen, we want you to keep your independence and not become a burden to those around you. So many patients are told they are bone on bone, but actually when they are evaluated by us, only 5% or less are actually bone on bone. We need to determine how much damage is in the joint and what is left to work with. These injections that we do are specific. So, to give you an idea of what happens in many other offices, 85% of providers do what is called a blind injection. 25% of the time, the knee is missed. They don't even get it into the actual joint. 55% of the time, the shoulder is missed. We use an ultrasound guidance machine to find the joint and make sure the injection gets to where it needs to be. Lastly, I want you to know, if cost is a concern, and it is at times with patients, I want you to know we offer multiple payment plans, some as low as $30 a week. We find that most people find one of our plans will fit their budget, regain their health and mobility, and continue to enjoy the quality of life that they have always enjoyed without having the limitation of pain, and they can get back to the things that they love doing. Again, my name is Dr. Stansberry, and I hope you found this video helpful. Now please, just sit back and relax, and someone will be with you here shortly. Thank you.